Tap water or filtered tap water is typically adequate. Unless you have specific water quality concerns, tap water is fine. Some people promote alkaline water for acne, claiming it reduces inflammation. However, your stomach acid immediately neutralizes any pH changes from drinking alkaline water, so drinking alkaline water doesn't meaningfully change your body's pH or skin conditions. Alkaline water claims are largely marketing. Herbal teas and other beverages contribute to hydration alongside water. Coffee and other caffeinated beverages have mild diuretic effects but still contribute to daily hydration. However, excessive caffeine consumption can worsen acne through stress and inflammation, so while counting toward hydration, caffeinated beverages shouldn't dominate your fluid intake. Hydration from food contributes to overall hydration. Fruits and vegetables contain significant water. Eating water-rich foods like watermelon, cucumber, lettuce, and citrus fruits contributes to hydration alongside drinking water. Relationship between hydration and acne typically takes 2 to 4 weeks to manifest. Improving hydration from dehydrated state to properly hydrated state might improve acne noticeably. However, increasing hydration beyond adequate amounts typically doesn't further improve acne. The practical approach: drink enough water to maintain adequate hydration, pale yellow urine, no thirst, distribute intake throughout the day, use lukewarm water for cleansing, and if you have hard or highly chlorinated water concerns, consider filtering. Hydration is one component of comprehensive acne management but not a standalone cure. Guide 36, Gut Health, Microbiome, and Emerging Research on Gut-Skin Axis. Emerging research increasingly implicates gut health and microbiota composition in acne development. Understanding gut-skin axis mechanisms and implementing strategies to support gut health offers another angle for acne management. The gut microbiome, the trillions of bacteria colonizing your digestive tract, influences systemic health including skin health. A healthy microbiome supports immune function, intestinal barrier integrity, nutrient absorption, and inflammation regulation. Microbiome dysbiosis, imbalanced bacterial composition, contributes to systemic inflammation, impaired immune function, and intestinal permeability, leaky gut, all of which correlate with worse acne. Several mechanisms link gut dysbiosis to acne. First, dysbiosis allows pathogenic bacteria to proliferate, producing lipopolysaccharides that trigger systemic inflammation. This systemic inflammation worsens acne. Second, dysbiosis compromises intestinal barrier integrity, allowing bacterial lipopolysaccharides and undigested proteins to enter circulation, further triggering inflammation and activating immune responses. Third, dysbiosis impairs production of short-chain fatty acids, butyrate, that support intestinal and immune health. Fourth, dysbiosis impairs estrogen metabolism in the gut, potentially contributing to hormonal acne in women. Several dietary factors contribute to dysbiosis. Excess sugar promotes pathogenic bacteria growth. Processed foods low in fiber and high in additives promote dysbiosis. Insufficient fiber intake results in inadequate short-chain fatty acid production. Excessive omega-6 polyunsaturated fat relative to omega-3 PUFA promotes inflammatory bacteria. Chronic stress, sleep deprivation, and certain medications, particularly antibiotics, also contribute to dysbiosis. Supporting gut health involves dietary modifications. Increasing fiber intake through whole grains, vegetables, legumes, and fruits promotes beneficial bacteria that produce short-chain fatty acids. Increasing omega-3 fatty acids relative to omega-6, eating more fish, walnuts, seeds, reducing processed food, supports beneficial bacteria. Consuming prebiotic foods, foods that feed beneficial bacteria, like asparagus, onions, garlic, and resistant starch supports beneficial bacteria growth. Fermented foods containing live bacteria provide probiotics supporting gut health. Yogurt, kimchi, sauerkraut, miso, tempeh, and kombucha all contain beneficial bacteria. Regular consumption of fermented foods supports diverse microbiota. However, benefits are modest compared to overall diet quality and should supplement rather than replace dietary improvements. Probiotic supplements provide concentrated bacteria claimed to support microbiota. However, evidence for probiotic efficacy is mixed and varying. Some people benefit noticeably from specific probiotic strains, while others see no benefit. If interested in probiotics, choosing high-quality products with documented effective strains, like Lactobacillus and Bifidobacterium species, and consulting your healthcare provider is reasonable. Probiotics for acne-specific benefit remain researched, not definitively proven. Avoiding unnecessary antibiotics protects microbiota. When antibiotics are necessary for infection, taking them is appropriate. However, demanding antibiotics for viral infections, which antibiotics don't treat, harms your microbiota unnecessarily. Using antibiotics only when truly needed protects long-term microbiota health. Managing stress supports microbiota health. Stress promotes dysbiosis through multiple mechanisms. Implementing stress management supports both gut and skin health through this mechanism. Adequate sleep supports microbiota health and is one of the highest impact microbiota interventions available. Most microbiota disruption occurs with sleep deprivation. Prioritizing 7 to 9 hours nightly supports microbiota health. Exercise supports beneficial microbiota diversity. Regular exercise promotes beneficial bacteria growth independently of diet. This is one of the many benefits of consistent exercise. Alcohol, particularly excessive consumption, harms microbiota. While occasional moderate alcohol consumption probably has minimal microbiota effects, chronic excess consumption disrupts microbiota significantly. Smoking harms microbiota, contributing another mechanism through which smoking worsens acne. Implications for acne management. While microbiota science is still emerging, supporting gut health through diet, fiber, whole foods, limited sugar, omega-3 support, probiotics potentially, though evidence is mixed, stress management, sleep, and exercise likely support skin health through multiple mechanisms including microbiota effects. These interventions support overall health beyond just acne, making them worthwhile even though direct acne benefit is still being researched. Guide 37, Hormonal Testing, Evaluation, and When to Pursue Endocrine Assessment for Acne. For women with hormonal acne, pursuing endocrine evaluation can identify underlying hormonal imbalances enabling targeted treatment. Understanding when hormonal testing is appropriate, which tests are relevant, and how to interpret results guides effective management. Hormonal acne patterns suggest hormonal involvement warranting evaluation. Acne appearing primarily on the jawline and chin, concentrated in the lower face, often indicates hormonal acne. acne worsening cyclically around menstrual periods strongly suggests hormonal involvement. Adult acne onset, particularly after the teenage years, is often hormonal. Caffeine and alcohol intake timing affects sleep quality. Caffeine consumed in the afternoon or evening disrupts sleep onset and quality. Alcohol consumption in the evening worsens sleep quality even though it might initially make you drowsy. Avoiding caffeine after 2 p.m. and limiting evening alcohol consumption improves sleep. Exercise supports both sleep quality and acne management through multiple mechanisms. Regular aerobic exercise, 30 minutes, 5 times weekly, improves sleep quality, reduces stress, regulates hormones, and improves acne. However, exercising too close to bedtime, within 3 hours, might disrupt sleep. Exercising earlier in the day optimizes both sleep and acne benefits. Sleep-specific skincare involves protective measures during sleep. Applying a heavy, occlusive moisturizer or night cream before bed protects skin during nighttime and supports barrier health. Night creams are often richer than daytime moisturizers because you don't need to worry about appearance or mattifying for makeup. Overnight hydrating masks provide intense hydration during sleep. Some people use occlusive oils, just a few drops of facial oil over moisturizer, to lock in maximum hydration overnight. Retinoid application at night leverages sleep's restorative processes. Applying retinoids in the evening, or before bed if your routine allows, means they work while your skin undergoes growth and repair during sleep. This timing often provides better results than morning retinoid application, though this varies individually. Acne spot treatments can be applied before bed to work overnight without interfering with daytime activities. Leaving benzoyl peroxide or other treatments on overnight provides extended contact time for therapeutic benefit. Silk or satin sleep masks or pillowcases are promoted for anti-aging and acne benefits. The reduced friction might slightly reduce acne, and the reduced moisture absorption compared to cotton might help slightly, but these effects are modest compared to other acne management strategies. If you like the feel of silk pillowcases and can afford them, they're worth trying, but they're not necessary for acne management. Optimizing sleep requires a multifaceted approach, maintaining 7 to 9 hours nightly, keeping consistent sleep schedules, avoiding evening screen use, limiting caffeine after 2 p.m., maintaining cool, moderate humidity bedroom, and changing pillowcases frequently. These changes take 2 to 3 weeks to impact acne, but most people notice significant improvement in acne after optimizing sleep long-term. Sleep is one of the most underrated acne management strategies. While topical treatments and professional treatments receive most attention, sleep optimization often provides dramatic acne improvement that rivals pharmaceutical treatments. Prioritizing sleep is one of the highest impact acne management strategies available. Guide 35, Water Quality, Hydration Science, and Optimal Water Intake for Clear Skin. While drink water for clear skin is commonly repeated, the mechanisms behind water's role in skin health and the specific amount of water actually needed for acne improvement are often misunderstood. Understanding water science and optimal hydration supports acne management. The myth that specific water quantities, 8 glasses daily, etc., directly treat acne is oversimplified. While adequate hydration supports overall health and skin function, consuming excessive water beyond your actual hydration needs doesn't further improve acne. However, maintaining proper hydration throughout the day supports skin health in multiple ways. Dehydration compromises skin barrier function. When your body is dehydrated, your skin compensates by producing more sebum to maintain oil barrier protection. Paradoxically, dehydrated acne-prone skin often appears oily while being dehydrated internally, creating conditions promoting acne. Proper hydration reduces this compensatory sebum production. Hydration supports skin cell function. Skin cells require water to function optimally. Proper hydration maintains cellular processes, supports detoxification, and promotes overall skin health. Dehydrated skin appears duller and is more prone to irritation and breakouts. Hydration supports immune function. Adequate hydration maintains lymphatic function and immune cell circulation, supporting your body's ability to fight acne-causing bacteria. Dehydration compromises immune function, potentially worsening acne. Hydration supports blood circulation. Well-hydrated blood flows more efficiently, delivering nutrients and oxygen to skin cells. Dehydration compromises circulation, reducing nutrient delivery to skin. Optimal daily intake intake varies based on body weight, activity level, climate, and individual factors. A general guideline is 35 milliliters per kilogram of body weight daily. For a 70 kilograms person, this equals approximately 2.5 liters, about 10 glasses, daily. However, individual needs vary significantly. Thirst is a reasonable indicator of hydration needs. Drinking when thirsty and monitoring urine color. Pale yellow indicates adequate hydration, dark yellow suggests dehydration, guides appropriate intake. Individual variation in optimal water intake is substantial. Some people need 2 liters daily for optimal hydration, while others need 3 to 4 liters depending on activity and climate. Rather than following a rigid 8 glasses recommendation, assess your personal hydration status and drink accordingly. Water intake timing matters somewhat. Distributing water intake throughout the day maintains consistent hydration better than consuming large amounts at once. However, excessive water intake shortly before bed disrupts sleep through nighttime urination. Tapers off water intake 2 to 3 hours before bed to optimize sleep quality. Electrolyte balance matters for hydration beyond pure water intake. Excessive water intake without sufficient electrolyte intake, sodium, potassium, magnesium, can disrupt electrolyte balance, causing problems. Consuming electrolyte-containing beverages or foods alongside water maintains balance. However, the Western diet typically contains adequate sodium, so electrolyte concerns are minimal for most people unless they're exercising extensively or sweating significantly. Water quality affects skin and acne through multiple mechanisms. Hard water, high mineral content, leaves mineral buildup on skin, potentially irritating it and compromising cleansing efficacy. Soft water cleanses more effectively. If you have very hard water, installing a water softener or using a shower filter might help. However, evidence for hard water directly worsening acne is limited. Chlorinated water can irritate acne-prone skin. Chlorine is drying and potentially irritating. Using filtered water for cleansing if you have highly chlorinated tap water might help. However, most chlorine in tap water is minimal and unlikely to significantly impact acne. Hot water is more drying to skin than lukewarm or cool water. Cleansing with lukewarm water rather than hot water reduces water-related dryness, particularly important for acne-prone skin already potentially compromised by active treatments. Distilled water versus tap water has minimal practical difference for skin health. Distilled water is free of minerals and chlorine but also lacks beneficial minerals. Becomes thin, allows excessive water loss, and becomes reactive to previously tolerated products and environmental factors. Signs of barrier compromise include tightness and discomfort, increased dryness and flaking despite using moisturizer, redness or inflammation without active acne, stinging or burning when applying products previously tolerated, increased sensitivity to temperature extremes, and heightened reactivity to skin care products, developing reactions to products that previously seemed fine. Several factors compromise the skin barrier during acne treatment. Multiple chemical exfoliants, salicylic acid, glycolic acid, used simultaneously strip away protective lipids excessively. Retinoids, while beneficial, can compromise the barrier during the initial adaptation phase. Benzoyl peroxide can be somewhat drying. Hot water and harsh cleansing compromise the barrier. Excessive sun exposure damages barrier function. The cumulative effect of multiple treatments or very aggressive single treatments overwhelms the barrier's ability to maintain function. Barrier repair requires specific approaches different from standard acne skin care. The goal shifts from treating acne to restoring skin health. This recovery phase typically lasts 2 to 4 weeks but can take longer with severe barrier compromise. The first step in barrier repair is stopping all unnecessary irritants. This means discontinuing strong actives temporarily. Stop salicylic acid, benzoyl peroxide, and retinoids. Stop chemical exfoliants. Stop high-concentration vitamin C or other potentially irritating ingredients. Use only gentle, basic skin care during the recovery phase. Gentle cleansing becomes paramount. Use only lukewarm or cool water with a very gentle, minimal cleanser or even just water cleansing. Avoid all manipulation or massage of the skin. Pat dry gently, don't rub. Minimize cleansing time, wash quickly and gently rather than scrubbing or massaging. Lipid-rich moisturizing is essential. Your barrier needs ceramides, cholesterol, and fatty acids. Moisturizers containing these lipids support barrier repair. Apply moisturizer to slightly damp skin immediately after cleansing to lock in hydration. Use generous amounts, don't skimp on moisturizer during barrier repair. Many people find that using moisturizer 3 to 4 times daily during barrier repair accelerates recovery compared to twice daily application. Humectant-rich products maintain skin hydration. Ingredients like hyaluronic acid, glycerin, and squalane draw water into the skin, supporting hydration during barrier repair. Many hydrating serums or essences contain these ingredients. Apply these before your moisturizer to layer hydration. Some people benefit from occlusive products during barrier repair. An occlusive final layer locks moisture into skin. Facial oils, jojoba, squalane, or balms create an occlusive layer over your moisturizer. This is particularly helpful at night when you're not exposed to environmental stressors. Centella asiatica, SICA, is a botanical ingredient that supports skin barrier repair through multiple mechanisms. It strengthens the barrier, reduces inflammation, and promotes skin resilience. Many products now contain SICA for its barrier-supportive properties. Using a SICA-containing product during barrier repair can accelerate recovery. Avoid all environmental stressors during barrier repair. Don't expose skin to extreme temperatures, hot showers, very cold weather. Use a humidifier to maintain ambient humidity, as dry air worsens barrier compromise. Avoid air conditioning when possible, it's drying, or use a humidifier to counteract its effects. Protect skin from sun exposure. Wear sun protection even though you're not using UV sensitizing treatments. Avoid actives and potential irritants completely during barrier repair. This means no vitamin C, no niacinamide in high concentrations, no peptides, no strong antioxidants. Even gentle ingredients might irritate severely compromised skin. Stick to cleanse, hydrate, moisturize, protect as your only routine. Timeline for barrier recovery typically takes 2 to 4 weeks. By week 1, you should notice reduced tightness and reactivity. By week 2, increased tolerance and reduced dryness. By week 3 to 4, most barrier compromise resolves. However, severely compromised barriers might take 6 to 8 weeks for complete recovery. During barrier recovery, you can still protect your skin from future acne. Using SPF 30+ sunscreen is essential and doesn't compromise recovery. In fact, it supports it by protecting your recovering skin. Sunscreen should be your only active product during this phase. Once your barrier has recovered, you're comfortable, no longer experiencing tightness or reactivity, and your skin feels resilient again, you can gradually reintroduce active treatments. However, do so carefully and at lower concentrations and frequencies than you used before. For example, if you were using 2% salicylic acid daily before barrier compromise, restart with 0.5% salicylic acid 2 to 3 times weekly. Build up slowly. Reintroduce treatments one at a time, waiting at least 1 to 2 weeks between introducing new actives. For example, reintroduce salicylic acid first, wait 2 weeks to ensure tolerance, then introduce benzoyl peroxide if desired. This sequential approach prevents recompromising your barrier. The barrier repair phase teaches valuable lessons about acne treatment. It emphasizes that more aggressive treatment isn't always better. Often, moderate treatment applied consistently yields better long-term results than aggressive treatment causing barrier compromise requiring recovery phases. Maintaining a healthy barrier improves overall skin health and can actually improve acne outcomes by supporting skin function. Some people find that once their barrier recovers, they can maintain clear skin with gentler treatment than they used before barrier compromise. For example, someone might have needed 2% salicylic acid daily and benzoyl peroxide to control acne, but after barrier recovery and switching to gentler 0.5 to 1% salicylic acid with retinoid maintenance, their acne stays controlled. This suggests that excessive barrier compromise actually worsened acne by disrupting skin function. Prevention is better than recovery. From the start of acne treatment, use appropriate concentrations and frequencies, incorporate moisturizing and barrier support, and listen to your skin's signals. If your skin is becoming very dry, tight, or reactive, reduce treatment intensity rather than continuing and causing more barrier damage. Long-term consistency matters more than short-term intensity. Guide 27. Cosmeceuticals and advanced skincare ingredients beyond standard acne treatments. Beyond the well-established acne treatments like benzoyl peroxide and salicylic acid, numerous cosmeceutical ingredients support acne treatment and skin health. Understanding these advanced ingredients allows you to optimize your acne regimen and support overall skin function. Peptides are short chains of amino acids that support skin structure and function. Some peptides have been studied for acne-supportive effects through anti-inflammatory mechanisms and barrier support. Matrixyl and similar peptides appear in many skincare products. While peptides aren't primary acne treatments, they support overall skin health and resilience. They're generally gentle and well tolerated. Include peptides in your routine for general skin support without expecting them to treat acne directly. Hyaluronic acid is a humectant that holds up to 1,000 times its weight in water, providing significant hydration. While it doesn't treat acne, maintaining proper hydration through hyaluronic acid improves skin function and barrier health. Using hyaluronic acid serums or moisturizers provides hydration support for acne-prone skin. Squalane is a lightweight oil that mimics skin's natural sebum without being comedogenic in most individuals. It provides hydration and lipid support for barrier function. Squalane is particularly useful for acne-prone skin that needs lipid support without the pore-clogging risk of heavier oils. A few drops of squalane can be added to moisturizer or serum for enhanced hydration. Niacinamide, vitamin B3, has multiple beneficial effects for acne-prone skin. It has mild antibacterial and anti-stimulating sebaceous gland activity and follicular changes. This is why adolescent acne is so common and often severe. Acne's psychological impact during adolescence is particularly significant due to developmental sensitivity about appearance and social dynamics. Acne during formative teenage years can cause lasting psychological effects. Taking adolescent acne seriously and treating it appropriately is justified. Guide 98, Acne and Body Dysmorphic Disorder, Distinguishing Clinical Concern from Pathology. Body dysmorphic disorder, BDD, is excessive preoccupation with perceived appearance flaws, sometimes involving acne. Distinguishing between appropriate concern about actual acne and BDD helps ensure appropriate treatment. Normal acne concern involves recognizing acne exists, wanting to treat it, and feeling moderately bothered. This is appropriate and doesn't indicate pathology. BDD involves disproportionate distress about minor or imagined flaws, repetitive behaviors, mirror checking, skin picking, comparing, significant functional impairment, and disproportionate appearance focus. Someone with BDD focused on acne might have minimal actual acne but experience severe distress and dysfunction from perceived severe acne. BDD requires mental health treatment, therapy, sometimes medications, rather than dermatological treatment alone. Treating actual acne doesn't resolve BDD if actual acne isn't the primary problem. Recognizing BDD allows appropriate referral to mental health providers. Dermatologists familiar with BDD can identify it and recommend mental health evaluation. Having actual acne doesn't preclude also having BDD. Someone might have real acne and also have disproportionate BDD-related distress. Guide 99, Acne Treatment Optimization through N-of-1 Experimentation. N-of-1 trials involve testing treatments in yourself systematically to determine what works best for your specific skin. This personalized approach optimizes your individual treatment. N-of-1 testing involves trying one treatment change at a time, tracking results objectively, comparing periods with and without treatment. For example, testing whether dairy worsens your acne. Eliminate dairy for 4 weeks while maintaining everything else constant, track acne objectively, then reintroduce dairy and track acne again. If acne improved without dairy and worsens with dairy reintroduction, dairy is likely a personal trigger. Similarly, testing whether specific products, ingredients, stressors, or other factors affect your acne using single-variable experimentation personalizes your treatment. Tracking variables, diet, sleep, stress, products used, acne status, in a detailed journal enables N-of-1 analysis revealing personal patterns. This personalized approach identifies your specific acne triggers and treatment responses better than general recommendations, since everyone's acne differs. Guide 100, Acne Future, Emerging Research, Potential Breakthroughs, and What's Next. Acne research continues advancing, with numerous promising approaches under investigation. Understanding emerging research provides hope for improved future treatments. Microbiome-targeted treatments using probiotics or postbiotics specifically addressing acne-associated microbiota changes are in development. These might provide more targeted bacterial management than broad-spectrum antibiotics. Precision medicine approaches using genetic testing to predict acne predisposition and treatment response are emerging. Personalized treatment based on genetic profiles might become reality. Immunotherapy approaches boosting immune response to acne bacteria or reducing inflammation are under investigation. Nanotechnology delivery systems enabling more targeted, deeper drug delivery are advancing. Future treatments might be more effective and have fewer side effects through optimized delivery. Gene therapy approaches, still experimental and far from clinical use, might eventually target genetic predisposition to acne. Plant-based and botanical treatments with stronger evidence are being developed. Future treatments might offer natural alternatives to synthetic drugs. Combination approaches targeting multiple acne mechanisms simultaneously are increasingly recognized as optimal. Future standard treatment might involve coordinated multi-mechanism attacks on acne. Artificial intelligence continuing to improve might eventually enable excellent personalized treatment selection and monitoring. Understanding that acne science advances constantly provides hope. Treatments available today vastly exceed what existed 20 years ago. Future treatments will likely be even better. Your acne is treatable now with current treatments. However, if current treatments insufficient, future advances might provide new options. Either way, clear skin is achievable. Starting with gentle treatments is appropriate for adolescents. Many teenagers' skin is quite resilient and tolerates strong treatments well, but starting conservatively establishes good habits. Teaching proper skincare techniques during adolescence establishes lifelong habits. Involving adolescents in treatment decisions increases compliance. Understanding why treatments are recommended, how to use them properly, and what results to expect improves adherence. Adolescents who feel involved in their treatment are more likely to stick with routines. Addressing acne myths prevalent among adolescents: chocolate causes acne, poor hygiene causes acne, etc., prevents reinforcing false beliefs and harmful behaviors. Professional dermatology involvement is appropriate even for moderate adolescent acne, as dermatologists can recommend appropriate treatments and monitor for complications like scarring. Discussing how acne affects emotional well-being opens conversations about mental health support if needed. If acne is causing depression or anxiety, professional mental health support should be offered. Realistic expectations help adolescents understand that acne improvement takes weeks to months, not days. Understanding this prevents discouragement. Guide 68, acne in older adults, age-related changes and treatment adjustments. Acne persisting into or developing in older adults has unique characteristics requiring age-specific management adjustments. Adult acne in those over 40 or 50 is often hormonally driven, particularly in women during perimenopause and menopause, and typically more inflammatory than comedonal compared to teenage acne. Aging skin is free. Most people experience slight redness that resolves within hours. Superficial peels are appropriate for mild acne, texture concerns, and maintenance. Monthly superficial peels combined with home treatments provide excellent acne management. Medium-depth peels penetrate into the dermis, providing more dramatic results but requiring more recovery. These use higher acid concentrations, 35 to 50% glycolic acid, TCA at 25 to 35%, or combinations, and require 3 to 5 days of significant peeling and flaking. Medium peels are appropriate for moderate acne, significant scarring, and hyperpigmentation. Results are more dramatic than superficial peels but carry higher complication risks. Most people perform medium peels quarterly rather than monthly. Deep peels penetrate deeply into the dermis, providing maximum results but requiring significant recovery time. These use very high acid concentrations, TCA at 50% plus, or phenol. Recovery takes weeks, and results are essentially permanent in terms of skin transformation. Deep peels carry significant risks and are rarely performed for acne specifically, being more appropriate for severe aging or significant scarring. Most dermatologists reserve deep peels for carefully selected cases. Laser treatments use focused light energy to treat acne, scarring, and pigmentation. Different wavelengths target different structures. Ablative lasers, CO2, 𝒂𝒄𝒊𝒂𝒐𝒏𝒔𝒊𝒏𝒈, remove skin layers through vaporization, providing maximum results but requiring weeks of recovery. Non-ablative lasers penetrate without removing skin, requiring less recovery but multiple treatments. Fractional lasers treat portions of skin, leaving untreated skin to support healing, requiring less recovery than full laser treatment. For acne specifically, fractional non-ablative lasers are most commonly used. These provide acne improvement through collagen remodeling and pore minimization without severe downtime. Typical treatment plans include 4 to 6 treatments spaced 4 to 6 weeks apart. Results appear gradually over months as collagen remodels. Fractional laser is excellent for acne scarring, pore size reduction, and texture improvement. Cost is typically $300 to $800 per treatment. Blue light therapy uses specific light wavelengths, around 415 nanometers, to kill acne-causing bacteria. Treatments are painless, require no downtime, and are suitable even for sensitive skin. Most treatment plans include 8 to 12 treatments performed twice weekly. Blue light is particularly valuable for antibacterial acne treatment without systemic antibiotics. Cost is typically $75 to $150 per treatment. Photodynamic therapy, PDT, combines a photosensitizing agent, topical aminolevulinic acid or methylaminolevulinate, applied to skin with subsequent light activation. PDT kills bacteria, reduces sebum production, and improves acne. Treatments are followed by 24 to 48 hours of photosensitivity and significant redness. Results are dramatic but require recovery time. PDT is reserved for severe acne resistant to other treatments. Radiofrequency, RF treatments deliver radiofrequency energy deep into skin, stimulating collagen, reducing sebum production, and improving acne. Multiple treatments are necessary, typically 4 to 6 treatments spaced 3 to 4 weeks apart. Radiofrequency is gentle, requires no downtime, and is suitable for various skin types. Results include both acne improvement and skin tightening. Microneedling creates controlled microinjuries triggering collagen production and skin remodeling. For acne, microneedling improves scarring and texture. For active acne, microneedling isn't appropriate as it can spread bacteria. Once acne is controlled, microneedling helps with residual scarring. Typical treatment plans include 3 to 4 treatments spaced 4 to 6 weeks apart. Microneedling is relatively affordable, $200 to $400 per treatment, compared to laser treatments. Extraction treatments remove comedones professionally. Hydrofacial uses suction and infusion to extract impurities without harsh manual extraction. Regular professional extractions by experienced estheticians safely remove comedones impossible to remove at home. Some dermatologists perform extractions as part of acne management, particularly when comedones are resistant to topical treatments. Intralesional steroid injections treat individual cystic acne lesions directly. A small amount of corticosteroid is injected into the cyst, causing rapid deflation and healing within days. This prevents cysts from persisting weeks or months and dramatically reduces scarring risk. Cost per injection is typically $25 to $75. This is not a treatment for widespread acne but rather for occasional large cysts. When considering professional treatments, assess treatment suitability for your specific concerns. Is your issue active acne, scarring, texture, or some combination? Different treatments address different concerns. Realistic expectations are essential. Even professional treatments require multiple sessions and gradual improvement over months. Budget considerations matter. Professional treatments can be expensive. Discuss your goals, budget, and expectations with your dermatologist. Combination professional approaches often yield best results. Monthly superficial chemical peels combined with quarterly fractional laser treatments, for example, address multiple aspects of acne and scarring simultaneously. Your dermatologist can recommend an appropriate combination for your specific situation. Guide 16: When to see a dermatologist, recognizing acne severity and treatment failure. Knowing when to seek professional dermatological help prevents prolonged acne suffering, psychological distress, and permanent scarring. Several clear indicators suggest you should see a dermatologist. Severe widespread acne covering large areas of your face and body warrants dermatological evaluation. Extensive acne suggests a need for systemic treatment beyond what topical treatments typically achieve. Dermatologists can prescribe oral medications, hormonal treatments, or Isotretinoin, Accutane, for severe cases. Numerous cystic acne lesions, particularly if they're large, painful, and prone to scarring, require professional intervention. Cystic acne rarely responds adequately to topical treatments and often requires intralesional steroid injections, oral antibiotics, or other systemic treatments. Treatment failure after 8 to 12 weeks of consistent appropriate treatment suggests your acne requires professional intervention. If you've conscientiously followed a good skincare routine with proven treatments like benzoyl peroxide, salicylic acid, and retinoids for 8 to 12 weeks without significant improvement, your acne likely requires prescription treatments or systemic medications. Rapid acne onset or sudden severe acne worsening in adults may indicate hormonal imbalances, medication side effects, or other medical conditions. Professional evaluation can identify underlying causes and recommend appropriate treatment. Women experiencing sudden severe acne should be evaluated for PCOS or other hormonal disorders. Acne causing significant psychological distress, depression, anxiety, or social withdrawal warrants professional intervention regardless of acne severity. Mental health impacts justify professional dermatological treatment. Acne with signs of infection, increasing warmth, swelling, pus drainage, fever, requires prompt medical attention. These signs may indicate infection beyond typical acne and require professional assessment and possibly antibiotics. Acne concentrated on your body, back, chest, shoulders, and resistant to typical acne treatments may indicate fungal acne or other skin conditions requiring professional diagnosis and treatment. Concerns about permanent scarring or hyperpigmentation justify professional consultation. Early professional intervention can prevent or minimize scarring through aggressive treatment or appropriate professional therapies. During a dermatology visit, be prepared to discuss your acne history, previous treatments tried and their results, family history of acne, recent lifestyle changes, menstrual history, if applicable, and medications or supplements you take. Bring photos of your acne at different stages if possible. Discuss your specific concerns, whether you're most worried about current acne, scarring, or overall timeline to clear skin. Your dermatologist can prescribe prescription-strength treatments unavailable over the counter. Prescription retinoids, tretinoin, adapalene, tazarotene, are more powerful than over-the-counter retinol. Prescription antibiotics, oral doxycycline, minocycline, or topical clindamycin, treat bacterial acne. Spironolactone manages hormonal acne in women. Isotretinoin, Accutane, is a last-resort powerful medication for severe acne resistant to other treatments. Your dermatologist can identify acne triggers specific to you and recommend appropriate prevention strategies. They can also recommend or perform professional treatments like chemical peels, laser therapy, or extraction that aren't accessible outside dermatology. Finding a good dermatologist matters. Ask for referrals from your primary care doctor, friends, or family. Check online reviews and credentials. During your first visit, assess whether the dermatologist listens to your concerns, explains treatments thoroughly, and seems genuinely interested in helping you. A good dermatologist-patient relationship improves treatment outcomes. Guide 17, Treating Rosacea, Seborrheic Dermatitis, and Other Acne-like Conditions. Several skin conditions mimic acne but require different treatments. Misdiagnosis leads to inappropriate treatment and worsening of the underlying condition. Understanding these conditions helps ensure proper diagnosis and effective treatment. Rosacea is a chronic inflammatory condition characterized by facial flushing, persistent redness, small blood vessels, and sometimes pustules. Unlike acne, rosacea typically doesn't involve comedones and occurs more commonly in adults over 30. Rosacea is triggered by heat, spicy foods, alcohol, stress, and certain skincare products. Treatment focuses on trigger avoidance and skin barrier repair rather than bacterial killing. Splashing from cooking, increasing sweat production and skin irritation. Heat exposure worsens acne. These workers need frequent face cleansing and good ventilation when possible. Outdoor workers, construction, landscaping, etc., experience sun exposure, heat, dirt, and sweat, multiple acne-promoting factors. Aggressive sun protection and sweat management are important. Office workers with high stress loads might experience stress-related acne. Stress management helps. Sports coaches and trainers are often in hot environments with sweat and frequent manual labor. Prevention strategies similar to athletes apply. Makeup artists and beauty professionals might have acne from product exposure or allergic reactions. Using quality, non-comedogenic products and maintaining clean equipment helps. Understanding your profession's specific acne-promoting factors allows targeted prevention. Many occupational acne factors can't be eliminated, can't stop wearing masks as healthcare worker, can't avoid heat as chef, but adapting treatments and prevention to account for occupational factors helps maintain clarity. Guide 76, Acne Myths and Misconceptions, Separating Fact from Fiction. Numerous myths about acne cause misinformation and sometimes harm. Understanding common myths helps you avoid misinformation affecting your treatment. Myth: acne results from poor hygiene. Fact: acne isn't caused by dirty skin or poor hygiene. Gentle cleansing is important, but over-cleansing worsens acne. Acne results from follicular occlusion, sebum production, bacteria, and inflammation, not dirty skin. Myth: chocolate causes acne. Fact: chocolate itself doesn't cause acne. However, high-sugar foods, which chocolate often contains, might worsen acne in some individuals through blood sugar and insulin effects. Myth: greasy foods cause acne. Fact: eating fatty foods doesn't directly cause acne through dietary fat transfer to skin. Excess calories from any source might contribute to inflammation and acne, but greasy foods specifically aren't acne-causing. Myth: acne will go away on its own eventually. Fact: some acne improves with age, but many people experience persistent acne requiring treatment. Waiting for spontaneous resolution wastes years. Myth: toothpaste treats acne. Fact: toothpaste isn't appropriate for acne and contains irritating ingredients. While older formulations sometimes contain benzoyl peroxide in tiny amounts, modern toothpastes shouldn't be used on skin. Myth: picking acne helps it heal. Fact: picking worsens acne, spreads bacteria, increases inflammation, and dramatically increases scarring risk. Never pick acne. Myth: sunlight cures acne. Fact: while temporary UV-induced drying might make acne appear better briefly, sun exposure actually worsens acne long-term through inflammation and post-inflammatory hyperpigmentation. Sunscreen is essential, not optional. Myth: all makeup causes acne. Fact: while some makeup clogs pores, many non-comedogenic cosmetics don't worsen acne. Appropriate cosmetic selection allows makeup use without acne worsening. Myth: acne only affects teenagers. Fact: adult acne is extremely common and can be more severe and treatment-resistant than teenage acne. Understanding that these myths are false prevents ineffective or harmful behaviors based on misinformation. Guide 77, Acne Treatment Resistance and When to Escalate Care. If acne doesn't improve despite appropriate treatment, several possibilities exist. Understanding why treatments fail helps guide next steps. Non-compliance is the most common reason treatments fail. Using treatments inconsistently, not using them as directed, or expecting results before adequate trial time has elapsed appears as treatment failure. Ensuring 8 to 12 weeks of consistent use before concluding treatment failed is important. Incorrect treatment selection for your acne type causes apparent treatment failure. Using treatments inappropriate for your acne type, for example, using salicylic acid for primarily inflammatory acne when benzoyl peroxide would be better, results in inadequate response. Inadequate treatment strength or frequency might result in insufficient improvement. Increasing frequency or concentration, appropriately, not aggressively, sometimes converts inadequate response to good response. Combination of multiple acne factors not addressed by your current treatment might cause inadequate response. Adding treatments targeting different factors improves outcomes. Underlying conditions, PCOS, other endocrine disorders, infections, causing acne might not be addressed by topical treatments. Seeking professional evaluation for underlying causes is appropriate. Barrier compromise from overuse of strong treatments sometimes appears as treatment failure, constant irritation rather than improvement. Taking a barrier repair break and restarting with gentler approach helps. When to escalate care, if single topical treatments haven't produced adequate improvement after 12 weeks, if your acne is moderate to severe from the start, if you have signs of hormonal acne, if you have deep cystic lesions, if acne is psychologically devastating. Escalating to professional dermatology care, combination treatments, or systemic treatments is appropriate. Professional dermatology can identify why treatments aren't working and recommend appropriate escalation. Don't tolerate inadequate acne improvement indefinitely. Professional help exists. Guide 78, Post-acne Skin Health Maintenance and Prevention of Future Problems. After achieving clear skin, maintaining skin health beyond just preventing acne ensures long-term skin quality and prevents premature aging. Sun protection remains essential post-acne for preventing aging and ensuring any residual hyperpigmentation doesn't worsen. Sunscreen habit established during acne treatment should continue indefinitely. Barrier health maintenance prevents irritation and premature aging. Continuing appropriate moisturizing even post-acne supports barrier function. Regular exfoliation at appropriate frequency maintains skin clarity without over-exfoliating. Many people benefit from continuing gentle exfoliation, perhaps reduced frequency from treatment levels, long-term. Antioxidant skin care, vitamin C, green tea, others, support skin health beyond acne treatment. These can be incorporated post-acne for anti-aging and general skin health. Retinoids continue providing anti-aging benefits beyond acne treatment. Many people maintain retinoid use specifically for anti-aging rather than acne. Hydration remains important. Maintaining good hydration habits supports skin health long-term. Regular professional skin care, facials, peels, or other treatments, helps maintain skin quality and address any minor concerns before they become problems. Guide 79, Acne Education and Advocacy, Reducing Stigma and Improving Understanding. Acne stigma and misinformation continue affecting people with acne. Education and advocacy help reduce stigma and improve treatment access. Education about acne as a medical condition, not hygiene or lifestyle failure, reduces shame. Educating others about acne biology helps reduce stigma. Advocacy for acne as legitimate medical concern, not purely cosmetic, helps ensure insurance coverage and professional attention. Acne affects mental health, self-esteem, and quality of life. It's not just appearance. Supporting those with acne through listening, normalizing their experience, and avoiding acne stigmatizing statements helps. Telling someone, "Just wash your face," or "Everyone gets acne, get over it," minimizes their legitimate struggles. Pushing for better acne education in schools helps teenagers understand acne and proper treatment earlier. Supporting dermatology access for all people regardless of income helps ensure everyone can access appropriate care. Advocating for inclusive acne research including diverse skin types ensures treatments developed work for everyone. Guide 80, Acne and the Senses, Smell, Touch, and Sensory Aspects of Skin Care. Beyond visual appearance, acne and skin care involve other senses affecting experience and compliance. Smell of skin care products affects whether people enjoy using them. Pleasant-smelling products increase compliance due to positive association. Some people prefer fragrance-free products to avoid irritation or strong smells. Touch sensations affect compliance. People enjoy using products that feel good on skin. Smooth-absorbing serums feel better than sticky formulations. This affects long-term routine adherence. Texture of products affects experience. Lightweight, smooth textures feel pleasant. Heavy, thick products feel uncomfortable, affecting compliance. Taste concerns arise if people accidentally get acne products in mouth, those should be avoided. Topical products shouldn't taste good, discouraging accidental ingestion. Sensory sensitivities, common in autism, sensory processing disorders, might affect product tolerability. Lightweight, minimally fragrant, smooth-textured products work better for sensory-sensitive individuals. Enjoyable sensory experience with skincare products increases likelihood of long-term compliance. Choosing products you enjoy using, good smell, nice texture, pleasant feel, supports routine adherence. Guide 81, Acne Recovery and Psychological Healing Post-Treatment. After achieving clear skin, psychological healing, moving past acne-related trauma, anxiety, or self-image damage, matters as much as physical healing. Cognitive reframing of acne experience recognizes acne as surmounted challenge rather than permanent identity. "I had acne and overcame it" differs from "I am acne-prone" in psychological impact. Rebuilding self-esteem after acne involves recognizing beauty and worth beyond skin appearance. Therapy or self-help work might support this. Managing residual anxiety about future acne recurrence is important. Some anxiety is adaptive, maintaining treatment compliance, but excessive worry isn't. Balance maintaining treatment with accepting that occasional breakouts don't mean failure. Celebrating clear skin and the journey to achieve it acknowledges the effort and success. This positive reinforcement supports continued treatment compliance. Relationships and social anxiety that develop during severe acne might persist even after clear skin. Gradual re-engagement in avoided activities supports recovery. Professional mental health support helps process acne-related psychological impact if significant trauma occurred. Guide 82, Acne and Climate Change, How Environmental Factors May Shift Acne Patterns. As climate changes, acne patterns and triggers might shift. Understanding climate-acne relationships helps anticipate these changes. Increasing temperatures in many regions mean more heat-driven acne. Sweat production increases with heat, increasing occlusion-related acne. Climate change's warming trend might increase acne prevalence. Increased humidity in some regions promotes bacterial growth and acne. Drier climates in other regions increase barrier compromise, contributing to acne. Increased air pollution from climate change effects worsens acne through oxidative stress and particle occlusion. Seasonal shifts might change acne seasonality patterns as climate changes. Increased stress from climate-related anxiety might affect acne through stress hormone pathways. Water quality changes from climate change might affect acne through different water exposure. While current climate change effects on acne are not yet clearly documented, these theoretical relationships suggest acne patterns might shift with climate. Being adaptable in acne management as environmental factors change is prudent. Guide 83, Acne in the Digital Age, Social Media, Online Communities, and Misinformation. Social media and online communities have transformed acne experience. Understanding digital age acne realities helps navigate benefits and pitfalls. Social media's focus on flawless appearance increases appearance anxiety and acne-related distress for some. Comparing yourself to filtered, edited images causes unrealistic expectations and self-esteem damage. Curated social media images where people show only their clearest skin days or use heavy filtering distort reality. Recognizing that everyone has imperfect skin days helps maintain perspective. Online acne communities provide support, shared experiences, and practical advice. These communities normalize acne and reduce isolation. Misinformation about acne spreads rapidly online. Evaluating source credibility and distinguishing evidence-based information from marketing or myth is important. Online acne forums sometimes feature unverified treatment claims. Being skeptical of anecdotal stories and seeking professional guidance for unusual claims protects you. Telemedicine dermatology accessed online expands access to professional care, beneficial for those without nearby specialists. Online skin analysis apps using AI might provide useful guidance but shouldn't replace professional assessment. Limiting social media exposure, particularly comparing images, supports mental health during acne treatment. Guide 84, Acne Treatment in Resource-Limited Settings. Many people globally lack access to standard acne treatments. Understanding available low-cost options and treatment adaptations helps those with limited resources. Over-the-counter benzoyl peroxide and salicylic acid are often affordable and available globally, even in resource-limited settings. These should be first-line treatments where available. Local botanical treatments, tea tree oil, neem oil, honey, used traditionally sometimes have evidence supporting their use. These are often affordable and locally available. Oral antibiotics, generic doxycycline, tetracycline, are often inexpensive in resource-limited settings, making oral antibiotic treatment accessible. Isotretinoin might be unavailable in many countries due to cost or regulatory restrictions, limiting treatment for severe acne without this option. Professional dermatology care might be unavailable or prohibitively expensive. Training non-specialist healthcare providers in basic acne treatment helps extend care availability. Commingle active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle, 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional, monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, Isotretinoin, Accutane, the definitive acne treatment for severe and resistant cases. Isotretinoin, commonly known by its former brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding isotretinoin, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. Isotretinoin is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes isotretinoin extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of isotretinoin. Many patients are cured permanently, their acne never returns. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. Monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the 𝑦𝒊𝒄𝒊 program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms should be reported to your dermatologist immediately. Depression and mood changes are particularly concerning. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13: Face masks and professional facials for acne management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles: never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily home routines yield better results than either approach alone. Professional treatments accelerate improvement and address concerns beyond what home treatments achieve. Frequency of professional facials depends on your skin concerns and treatment type. Most people benefit from monthly treatments initially, then maintenance every 4 to 8 weeks once acne clears. Discuss appropriate frequency with your esthetician or dermatologist based on your skin condition and treatment response. Professional facials can be expensive, but the results often justify the investment for moderate to severe acne or significant scarring. Many dermatology offices offer facials at reasonable costs compared to standalone aesthetic spas. Guide 14: Diet, Nutrition, and Lifestyle Changes for Clear Skin. While skincare products are essential for acne management, what you consume and how you live profoundly affects your skin. Understanding dietary and lifestyle factors allows you to address acne from internal and external angles simultaneously. High glycemic foods spike blood sugar rapidly. When blood sugar spikes, salicylic acid formulations meant to be applied to specific areas or the entire face, typically 2 to 3 times weekly. They're left on the skin and provide significant exfoliation. These are powerful products best used by those with resilient, acne-prone skin who have already adapted to gentler salicylic acid products. Spot treatments apply high concentrations of salicylic acid directly to individual breakouts for targeted treatment. These are excellent for treating isolated pimples without exfoliating your entire face. Starting with salicylic acid requires a conservative approach. If you've never used it before, begin with a 0.5% cleanser or 1% toner used 2 to 3 times weekly. Use it for 2 to 3 weeks, assessing your skin's response. If your skin tolerates it well without excessive irritation, dryness, or sensitivity, you can increase frequency to daily use or switch to a higher concentration product. When applying salicylic acid toners or serums, use clean fingertips or a cotton pad to apply evenly across your face, focusing on areas prone to acne. Use about a nickel-sized amount for your entire face. Apply to completely dry skin. Applying to damp skin increases irritation. Allow the product to dry completely before applying other products. Some salicylic acid products are meant to stay on your skin indefinitely, while others are meant to be rinsed off after a specific time. Read instructions carefully. Common mistakes when using salicylic acid include starting with too high a concentration, using it too frequently, combining it with too many other actives, and failing to moisturize adequately afterward. Starting with 2% and using it daily will almost certainly cause excessive irritation, dryness, and peeling. You're much better served starting gently and gradually increasing. Never combine salicylic acid with benzoyl peroxide on the same evening initially. Both are exfoliating actives that can cause significant irritation if used together by someone whose skin isn't accustomed to strong treatments. Once your skin has adapted to each individually, you might combine them cautiously, but build up to this gradually. Salicylic acid makes your skin more sun-sensitive, not severely, but notably. Always use SPF 30+ sunscreen daily when using salicylic acid. This is not optional. Sun exposure can cause post-inflammatory hyperpigmentation in acne-prone skin, and salicylic acid increases this risk. Side effects of salicylic acid are generally mild and resolve with time or reduced usage. Dryness is common, particularly if you're using higher concentrations or frequent applications. Combat dryness by using a good hydrating moisturizer immediately after applying salicylic acid. Mild peeling is normal and actually desirable. It indicates exfoliation is occurring. However, severe peeling suggests you're using too much. Slight irritation and redness may occur initially but typically resolve within 1 to 2 weeks. Some people experience temporary worsening of acne as impurities are brought to the surface, but this purging phase is usually short-lived. Results from salicylic acid appear gradually. After 2 weeks of consistent use, you might notice smoother texture. After 4 weeks, you should see reduced comedones and fewer new breakouts. Most people see significant improvement after 6 to 8 weeks of consistent use. However, salicylic acid works best for comedonal acne, blackheads and whiteheads, and mild inflammatory acne. For severe inflammatory or cystic acne, combining salicylic acid with other treatments like benzoyl peroxide or prescription retinoids is often necessary. Salicylic acid is safe for long-term use. Many people successfully maintain clear skin using salicylic acid indefinitely as their primary exfoliation and treatment method. However, occasionally, skin can become desensitized to salicylic acid if used continuously for extended periods. If you notice that salicylic acid that previously worked well seems less effective, take a 1 to 2 week break, then resume using it. This often restores its effectiveness. Alternatively, you can rotate between salicylic acid and other exfoliants like glycolic acid to prevent desensitization. Guide 5. Benzoyl peroxide, Comprehensive Guide to Bacterial Killing and Inflammatory Acne Treatment. Benzoyl peroxide is one of the most effective and widely recommended acne treatments by dermatologists. Unlike salicylic acid, which primarily removes dead skin cells and excess oil, benzoyl peroxide specifically targets the acne-causing bacterium 𝑭𝒂𝒄𝒊𝒂𝒍 acnes. Understanding benzoyl peroxide's mechanism, concentrations, and proper application is crucial for maximizing its effectiveness while minimizing side effects. Benzoyl peroxide works through a unique mechanism. It generates reactive oxygen species that directly kill bacteria. This is fundamentally different from antibiotics, which the bacteria can develop resistance to. Bacteria cannot develop resistance to benzoyl peroxide because it works through oxidative stress rather than targeting specific bacterial proteins. This makes benzoyl peroxide an invaluable tool in acne treatment, particularly since antibiotic resistance is an increasingly serious problem in dermatology. Beyond bacterial killing, benzoyl peroxide has anti-inflammatory effects, helping reduce the redness and swelling associated with inflammatory acne. It also has mild sebum-reducing properties and may help with some degree of cum-dun reduction, though it's less effective for this than salicylic acid. Benzoyl peroxide comes in concentrations ranging from 2.5% to 10%, with some over-the-counter products going up to 10% and prescription-strength versions available at higher concentrations. Interestingly, studies show that 2.5% benzoyl peroxide is roughly equivalent in effectiveness to 10% benzoyl peroxide. The higher concentration doesn't necessarily mean better results, it primarily means more potential for irritation. Therefore, it's prudent to start with 2.5% and only increase concentration if needed. Benzoyl peroxide comes in multiple product formats. Cleansers containing 2.5 to 5% benzoyl peroxide gently incorporate this ingredient into your daily cleansing routine. These are appropriate for maintenance or mild acne. Spot treatments allow you to apply high concentrations directly to individual pimples. Serums or leave-on treatments apply benzoyl peroxide across your entire face and are left on the skin. These can be used daily or as directed. Gels and creams are thicker formulations that may have different absorption characteristics depending on your skin type. Starting with benzoyl peroxide requires similar caution as salicylic acid. If you're new to benzoyl peroxide, begin with a 2.5% product, ideally in a cleanser format or spot treatment, used once daily. Most people find evening application easier than morning application since benzoyl peroxide doesn't require sun protection and can be easily washed off in the morning. After 1 to 2 weeks, assess your skin's tolerance. If you're experiencing mild irritation or dryness but your acne is improving, continue. After 2 to 3 weeks, if your skin tolerates the product well, you can increase frequency to twice daily or increase the concentration to 5%. Application technique is critical. Apply benzoyl peroxide to completely clean, completely dry skin. This is more important with benzoyl peroxide than with most other products. If your skin is even slightly damp, benzoyl peroxide will irritate more readily. Allow your cleanser to fully absorb and dry, then apply benzoyl peroxide. Use a small amount, about the size of a pea for your entire face if using a leave-on product, or a slightly larger amount for spot treatment. Apply gently, allowing the product to absorb fully before applying other products. Benzoyl peroxide has a particular drawback: it bleaches fabrics and hair. If you apply it to your face, it can bleach your pillowcase, bedding, towels, and hair. Many people apply benzoyl peroxide in the evening and wash it off in the morning with their cleanser to avoid this issue. If you apply it in the morning, be extremely careful not to get it on your hair, eyebrows, or any colored clothing. Some people apply it as a spot treatment right before bed, allowing it to work overnight before being washed off in the morning. If bleaching is a concern, you might prefer using benzoyl peroxide in a wash-off cleanser format where the contact time is brief. Side effects of benzoyl peroxide are generally more significant than salicylic acid. Dryness is very common, particularly with higher concentrations or frequent applications. Combat this by using an excellent moisturizer after applying benzoyl peroxide. Some people find that benzoyl peroxide dries their skin excessively even at 2.5% concentration. If this is you, try reducing frequency to every other day or using it only as a spot treatment. Irritation and redness are common, particularly when starting benzoyl peroxide or when increasing concentration. This irritation is usually temporary and subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, dermatitis, or reactions, discontinue use and consult a dermatologist. Contact dermatitis to benzoyl peroxide, while rare, does occur. If you develop an itchy rash that doesn't improve with reduced frequency, you may be allergic. Discontinue use and inform your dermatologist. Many people experience acne purging when starting benzoyl peroxide, temporary worsening of acne as bacteria die off and impurities are brought to the surface. This purging typically lasts 1 to 2 weeks. If purging lasts longer, consult your dermatologist. Photosensitivity is not a significant issue with benzoyl peroxide like it is with some other acne treatments, but you should still use sunscreen daily for general skin protection. Benzoyl peroxide is particularly effective for inflammatory papules and pustules, the classic red pimples with white centers. It's less effective for comedonal acne, blackheads and whiteheads, where salicylic acid is superior. Many dermatologists recommend combining benzoyl peroxide with salicylic acid for comprehensive acne treatment. Use salicylic acid to address comedones and exfoliate, and benzoyl peroxide to kill bacteria and reduce inflammation. Results from benzoyl peroxide appear relatively quickly. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. Monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the 𝑭𝒂𝒄𝒊𝒂𝒍 program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms should be reported to your dermatologist immediately. Depression and mood changes are particularly concerning. While actual isotretinoin-induced depression is rare, patients do report mood changes, and there's ongoing debate about causation versus correlation. Patients with personal or family history of depression should discuss this risk carefully with their dermatologist. Many dermatologists don't prescribe isotretinoin to patients with untreated depression or psychiatric conditions, or do so with additional psychiatric monitoring. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in 𝑦𝒏𝒏𝒔𝒊𝒏𝒈. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Non-compliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22, Oral Antibiotics for Acne, Types, Mechanisms, Resistance, and Long-Term Management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. Understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First, they kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. It's more sensitive to irritation and barrier compromise than younger skin. Acne treatments tolerated well at 20 might be too irritating at 50. Gentler approaches and more aggressive moisturizing are often necessary. Skin barrier function naturally declines with age, requiring more careful barrier support during acne treatment. Sensitive skin becomes more common with age. Menopausal acne related to estrogen decline often requires hormonal approaches, hormone replacement therapy or other hormonal management, rather than relying solely on topical treatments. Dryness is more common with age and often worsens with acne treatments. Aggressive moisturizing becomes increasingly important with age. Combining anti-aging skincare with acne treatment becomes relevant in older adults. Using retinoids addresses both acne and aging simultaneously, though barrier support becomes more important. Sun damage accumulated over decades makes older adults more susceptible to post-inflammatory hyperpigmentation and other post-acne complications. Extra sun protection is crucial. Taking medications for various age-related conditions, blood pressure medications, cholesterol medications, etc., increases medication-acne interaction risks. Discussing acne treatments with healthcare providers familiar with your complete medication list is important. Guide 69, Acne Severity Scoring and Objective Progress Measurement. Objectively measuring acne severity and progress helps distinguish real improvement from perceived improvement and guides treatment adjustments. Several acne severity scoring systems exist. The Global Acne Grading System, GAGS, assesses lesion counts and types in different facial regions, providing an objective severity score. The Investigator Global Assessment, IGA, uses clinical judgment to rate severity on a scale. Various others exist with different approaches. Lesion counting helps objectively track progress. Counting comedones, blackheads and whiteheads, inflammatory papules, and pustules weekly or monthly provides objective data showing whether acne is improving. Photography provides visual documentation of progress. Taking consistent photos, same lighting, same angle, same time of day, monthly allows comparison showing improvement that might not feel obvious during the journey. Apps and digital tools can help track lesion counts, take comparison photos, and document progress over time. Severity scoring helps determine whether treatments are working and justify continuing them. If you're using a treatment and lesion counts aren't decreasing after 8 to 12 weeks, this objective data helps justify trying different treatments rather than continuing ineffective approaches. Baseline severity assessment establishes starting point for treatment. Knowing whether you started with mild, moderate, or severe acne contextualizes improvement. Someone improving from severe to moderate acne shows real progress even if not completely clear. Long-term tracking shows patterns, whether acne is generally improving, stable, or worsening over months. This helps distinguish temporary fluctuations from trends. Showing objective improvement to healthcare providers demonstrates treatment effectiveness and justifies continuing treatments or pursuing additional interventions. Guide 70, Acne and Physical Activity, Exercise Benefits and Sweat Management. While exercise's acne-triggering potential through sweating is often emphasized, the overall benefits of exercise for acne typically outweigh risks. Understanding how to exercise safely while managing sweat-related acne allows enjoying exercise benefits without acne worsening. Exercise benefits acne through multiple mechanisms: stress reduction, stress hormones worsen acne, improved sleep, critical for skin health, improved circulation, nutrient delivery to skin, hormonal regulation, particularly in women, and improved overall health. These benefits typically outweigh acne risk from sweat. Sweat itself doesn't cause acne. Bacteria combining with sweat, sebum, and dead skin cells in clogged pores causes acne. Managing sweat through hygiene and clothing prevents sweat-related acne. Sweating during exercise increases bacteria and creates moist environment promoting bacterial growth. However, showering within 1 to 2 hours after exercise removes sweat and bacteria before significant growth occurs. Wearing breathable, moisture-wicking clothing reduces sweat accumulation and bacterial growth compared to cotton or tight, non-breathable clothing. Avoiding touching your face during exercise prevents transferring sweat and bacteria to your face and spreading existing bacteria from your hands. Sports bras and tight athletic tops can cause friction and occlusion-related acne in those areas. Ensuring equipment is clean and fits properly reduces friction acne risk. Increasing hydration during exercise supports overall health and skin health. Well-hydrated skin functions better than dehydrated skin. Post-exercise cleansing is crucial. Showering or at least cleansing your face and areas covered by equipment prevents sweat and bacteria from sitting on skin for extended periods. The net effect of regular exercise is almost always positive for acne despite sweat concerns. The stress reduction, sleep improvement, and hormonal benefits typically outweigh sweat-related acne risks. Don't avoid exercise due to acne concerns. Instead, manage post-exercise hygiene properly. Guide 71: Adapting acne treatment for different body locations. Acne appearing on different body areas often requires treatment adaptation due to different skin characteristics and environmental factors across body regions. Facial acne, forehead, cheeks, nose, chin, is most common and receives most treatment attention. Facial skin typically tolerates stronger treatments better than body skin. Back acne, acne on chest and upper back, is common in males and can be severe. Body skin is thicker than facial skin and often tolerates stronger treatments. Back acne often involves larger lesions and deeper inflammation. Shoulder acne results from friction, bra straps, sweat accumulation, and clothing occlusion. Treatment combines friction reduction, sweat management, and topical treatments. Buttock acne results from friction from sitting, tight clothing, and occlusion. Prevention focuses on wearing loose, breathable clothing and good hygiene. Topical treatments similar to face can be used. Armpit/axilla acne results from sweat accumulation, friction from deodorants and antiperspirants, and occlusion. Gentle hygiene and avoiding irritating products help. Neck acne requires careful treatment as neck skin is thin and sensitive. Gentle treatments appropriate for sensitive facial skin are often better tolerated than stronger treatments. Scalp acne, acne on hairline and scalp, involves hair follicles and is often fungal or bacterial. Antifungal or antibacterial scalp treatments help. Keeping scalp clean, using clean hair products, and avoiding overly oily scalp conditions helps. General principle: treat body acne similarly to facial acne but account for thicker skin on body, can often tolerate stronger treatments, and friction/occlusion factors. Hygiene is even more important for body acne due to sweat and clothing occlusion. Guide 72, Acne Treatment and Athletic Performance. Does acne treatment affect athletics? Some athletes worry that acne treatments affect athletic performance. Understanding whether treatments impact performance helps athletes make informed treatment decisions. Benzoyl peroxide and salicylic acid don't directly affect athletic performance. These topical treatments have minimal systemic absorption. Some experimentation, patience, and willingness to adjust based on results. Most acne responds to consistent, appropriate treatment. Your clear skin is achievable with the right approach for you specifically. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties leads to clear, healthy skin. Your acne journey is unique, but clear skin is absolutely achievable. #20 Expert Level Skin Care and Acne Treatment Guides, Part 3. Each guide, 10 to 15 minutes reading time. Guide 31, Acne Scar Treatments, Comprehensive Guide to All Scar Types and Advanced Therapy Options. Acne scars represent permanent reminders of severe acne, but modern dermatology offers numerous treatment options that can significantly improve scarring. Understanding different scar types, appropriate treatments, realistic outcomes, and combination approaches enables you to effectively address post-acne scarring. Acne scars exist in 3 primary morphologies, each requiring different treatment approaches. Ice pick scars are deep, narrow indentations resembling puncture wounds from an ice pick. These scars have sharp edges and typically measure 1 to 4 mm in diameter but penetrate deeply into the dermis. Ice pick scars are difficult to treat because their narrow base makes many standard treatments ineffective. Boxcar scars are wider depressions with relatively flat bottoms and sharp, vertical edges. These scars typically measure 4 to 6 mm or larger in diameter. Boxcar scars appear similar to chickenpox scars. Rolling scars are shallow depressions with sloping, rounded edges creating a wave-like appearance across the skin. Rolling scars often appear worse when skin is stretched due to their tethered nature. Understanding scar depth and type guides treatment selection. Shallow scars are often more responsive to surface treatments, while deep scars require deeper penetrating treatments. Mixed scar types within the same individual require combination approaches. Prevention remains the gold standard scar treatment. Avoiding picking, squeezing, or extracting acne prevents scarring. Treating acne aggressively to minimize deep inflammation prevents scarring. For anyone prone to severe acne, considering isotretinoin to prevent scarring is appropriate if acne is severe enough to cause scarring risk. For existing scars, numerous treatments provide varying degrees of improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural collagen loss that topical products cannot reverse. However, treating associated hyperpigmentation with topical treatments makes scars less noticeable. Subcision is a minor surgical procedure particularly effective for rolling and tethered scars. A needle or small scalpel is inserted under the scar, severing fibrous tissue anchoring the scar to deeper structures. This allows the scar to elevate as new collagen forms underneath. Subcision often requires multiple treatments performed weeks apart. Results develop over months as new collagen remodels. Subcision combined with other treatments, fillers, microneedling, often provides better results than subcision alone. Microneedling creates controlled microinjuries triggering collagen production and remodeling. The skin's healing response generates new collagen, improving scar appearance. Multiple treatments, typically 3 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Microneedling works for all scar types but is particularly effective for rolling and moderate boxcar scars. Post-treatment appearance includes temporary redness and microcrusting. Recovery takes 3 to 5 days for most people. Microneedling is relatively affordable compared to laser treatments and is increasingly popular for scar treatment. Radiofrequency microneedling combines microneedling with radiofrequency energy for enhanced collagen stimulation. This provides better results than standard microneedling but with more significant post-treatment appearance changes and potential side effects. Laser resurfacing removes thin layers of skin, smoothing scars and promoting collagen remodeling. Fractional laser resurfacing treats portions of skin, leaving untreated bridges for faster healing and less downtime than full resurfacing. CO2 fractional lasers are highly effective for acne scars. Multiple treatments, typically 4 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Post-treatment appearance includes significant redness lasting several weeks and potential for whitening, hypopigmentation. Cost is substantial, $500 to $1,500 per treatment, but results are often dramatic. 𝒂𝒄𝒄 fractional lasers are slightly less aggressive than CO2 lasers, with somewhat less downtime and slightly less dramatic results. For those seeking good results with less recovery time, 𝒂𝒄𝒄 is a reasonable option. Chemical peels remove skin layers through acid application. Superficial peels with glycolic or salicylic acid remove only the superficial layer and provide minimal scar improvement. Medium-depth peels with TCA, trichloroacetic acid, penetrate deeper, removing epidermis and superficial dermis, providing better scar improvement. Medium peels require 5 to 7 days of peeling and recovery. Deep peels with phenol or high-concentration TCA penetrate most deeply but require significant recovery time and carry higher complication risks. Deep peels are rarely used for acne scars specifically, being reserved for severe aging or other conditions. Dermal fillers inject material beneath scars to elevate depressed scars temporarily. Different fillers last different durations. Hyaluronic acid fillers typically last 6 to 12 months, while longer-lasting fillers, calcium hydroxylapatite, polyl-lactic acid, last 12 to 24 months. Filler results are immediate, making this attractive for short-term improvement. However, repeated treatments are necessary to maintain results. Fillers work particularly well for ice pick and boxcar scars. Platelet-rich plasma, PRP, therapy uses concentrated growth factors from your own blood to stimulate collagen production and healing. PRP is injected into scarred areas, promoting new collagen formation. Multiple treatments are typically needed. While PRP is popular, evidence for its efficacy in acne scar treatment is mixed, and it's more commonly used as a supplement to other treatments rather than as monotherapy. Combination approaches yield best results for acne scarring. A typical combination might include subcision for tethered scars, followed by microneedling for collagen stimulation, combined with fractional laser for surface smoothing and additional collagen remodeling. This multimodal approach addresses different aspects of scarring simultaneously. Treatment planning requires professional expertise. Severe, extensive scarring warrants referral to specialized dermatologists experienced in scar revision. Your dermatologist